Did you know there is a difference between palliative care and hospice care? Well, I get to meet with Sarah again today, and let's talk about that. Terri Maxiner here with Terri Talks, and we thank you for joining us. I have Sarah Paul here, medical social worker with Providence at Home. And I think we get confused when it comes to hospice care, palliative care, when the two meet, when they stay separated. So Sarah is our expert, not myself, so that's why I get to ask the question. So I'm learning just as long as you're learning, and I think that's a great thing. So I know it's a big loaded question, Sarah, but what is that difference between palliative care and hospice care?
Sure. So palliative care is called comfort care sometimes. It is working on symptom management, but hospice is also called comfort care, so it's hard to differentiate between the two. Palliative is generally used a lot in hospitals because people are needing symptom management and help deciding what to do with their terminal illnesses, and the hospital palliative team will assist with that. The good thing about our Providence program is it doesn't end in the hospital. You can go home to your house, you can go home to a nursing facility, or you can go into rehab into a nursing facility and continue Providence palliative care at that site. So what our palliative team does is I come out and meet with you. I explain to you what palliative is, which is providing comfort while getting aggressive treatment. And aggressive treatment is considered chemo treatment.
Okay.
It is considered dialysis is an aggressive treatment. Radiation.
Okay.
If you're going out for CHF clinic visits, that's considered aggressive. So anything that you're aggressively treating, but you're having trouble managing symptoms. So in between, you're having shortness of breath, you're having pain, you're struggling with swelling that you can't get under control. Those are all symptoms that a palliative nurse practitioner can help manage and keep you comfortable while you're going through this disease process. You may not be exactly terminal yet. You may just be struggling with a disease that can be terminal, so dialysis and end-stage renal disease. You can live on dialysis for many years, but you might be struggling with the symptoms of dialysis because your body is starting to struggle. So the palliative nurse practitioner would come in, take care of your symptom management, and then as things change, would be helping you and your family understand this is what the disease is doing, this is where we're going. So palliative is also used as a bridge for hospice services. So it's usually at the end stage of a disease where someone comes onto palliative. It's not the day you first start dialysis and you're doing really well. It's longer down the line in the disease process. So whatever that disease is, whether it's a heart disease, kidneys, lungs, palliative can help, especially in the home setting. We find it really helps because you don't have those nurses there and everything for you. So a nurse practitioner comes to your house and will talk about that stuff with you, and then also pull in a social worker if needed. So you'll have those resources. They will order your medications for you. They are covered through your Medicare Part D or whatever Medicare insurance plan you have, or perhaps a different prescription plan that you have. We do have options for prescription plans. If you don't have them through our social worker, you can ask us how to get some help with prescriptions. So our palliative nurse practitioner works with the social workers to make sure that not just their symptoms are taken care of, but they have what they need at home as well. So if they need financial resources or things like that, we'll work on that with them too.
So it really is almost this comprehensive piece, which I think would give me so much relief, because this could be putting, or I should say putting, exactly opposite, keeping my loved one out of the hospital.
That is the goal. So if there's an emergency, you would call our 800 number, and the nurse would tell you this is what we need to do, this is what the symptom is, this is what we need to manage, and then our nurse practitioner could come do a visit the next day. So the difference is our nurse practitioner is visiting like a doctor, where with hospice, our nurses are available for visits 24 hours, 7 days a week. So a doctor won't come out at 3 a.m. when you call, but the hospice team will. So once you transition over into hospice, which is typically a prognosis of 6 months or less, people think that it's going to be immediate. We have people on hospice for days, weeks, months, and even a year or more, because only the Lord knows when our time is. So we look at the symptoms, and doctors say this is typically a terminal diagnosis, and then we put people on hospice, and we see that they improve a little bit. And then families are, well, maybe we made the wrong decision. Well, what happens with hospice is people improve because we are focusing on improving their quality of life. That is literally our our goal, is to improve your
Yes,
quality.
yes.
So if you don't get better when you get on hospice a little bit, we're not doing something quite right.
Right.
So your symptoms are going to get better. Your pain is
Exactly.
going to get under control. Your breathing is going to be more comfortable. You're going to have nausea medication available if you're nauseous. So all these things that are going to make you feel better. So you do perk up a little bit. You start getting visits from an aide to help you do your showering, so you're not as exhausted but doing it yourself. You're not relying on your child to
Yeah.
come in and do it for you when you don't want to put that on them, or you don't
Exactly.
want the privacy. Sometimes that's a really big thing for people, or it's a father and daughter or mother and son, and they don't want that
Exactly.
dynamic. It's kind of hard.
Yeah.
So our aide will come in and do all that bathing for you and handle simple things. They'll sit with somebody and do their nail polish if they want their nails done, things like that. You know, we just want things to be good for you. We have social workers that are available to come in. We have chaplains available to come in. We provide not just support to the patient, but to the caregivers
Right.
and the family too. So whether that caregiver is in a nursing home, the nurses and the staff we help, or whether it's in a private home, then we'll be helping your family members or your caregiver, whoever's taking care of you.
Right.
So hospice is a full team, and so it's a
Palliative.
lot of resources, and it is 24 hours, 7 days a week. Where palliative is a nurse practitioner and a social worker who are available kind of like doctor's visits on appointment-based needs. And there is no emergency that we can come and rescue on palliative. If there was a true emergency, it would be a 911 to the hospital.
Right.
So in hospice, we stop those true emergencies by having emergency medication available in the house,
Right.
and the nurse coming straight out if there's a problem. So you don't have to call 911. You don't have to go back to the hospital.
Yeah.
And we find that when we don't rehospitalize patients, their symptoms stabilize. Their
Absolutely.
symptoms stabilize, their health gets a little bit better, and they're more comfortable. So we prevent a lot of things that going into the hospital kind of compounds.
Exactly.
So that's one of
Well,
our
and I
big
think,
goals.
too, that even the folks understanding that really, you know, any older adult should probably be on some form of palliative care. You know, just staying comfortable for the rest of your days. And then having that expert there to say, you know what, it's time to talk about hospice.
Yeah, anytime
really-
you've got some terminal diagnoses
Right.
or just comorbidities, you might have a heart problem, with a lung problem, with a kidney
Right,
problem. When you start to
exactly.
get a lot of hospitalizations, that's kind of a big flag to say, hey, what can I do to stay at home more often? Even if you're not appropriate for hospice, looking at the big picture, what
Correct.
is going to keep me home? What is going to keep me healthy?
Yes.
And that's where palliative nurse practitioners come in. You're having all these symptoms that aren't
Right.
managed well. Let us
Let's
manage
do
these for
something
you.
about
And
that.
so sometimes people graduate our palliative program actually quite often. You know, maybe they had something that was wrong, and our nurse practitioner gets in and sets everything up and
Right.
teaches the family what's needed. And after a couple months, there's nothing else for her to do because it's managed and they're comfortable and stable.
Perfect.
And then they graduate.
That's
so
a-
not everybody goes straight to hospice. Some
Right.
people get better. And some people on hospice get better, and that doesn't mean that they have to graduate either. It means that we did our job right. They're getting better, they're
Exactly.
feeling better.
Yes.
Occasionally people do graduate from hospice if they had a disease that wasn't like sepsis maybe, that wasn't
Right.
something that's a heart condition,
Exactly.
and it clears up after a while and nobody can predict it. So
Yeah.
a lot of different things happen with hospice and palliative, but the main difference is the level of support.
Exactly.
The level of support and the accessibility to that support.
Yep.
So with hospice, you have that 24/7 accessibility, and with palliative, you have to schedule visits. So that is different.
Yeah, and I think too for our audience to know that I know we gave you a lot of information, but if there's questions, just trying to differentiate all of that. You know, the hospice team can be notified.
Yep.
1-800.
509-2800,
Yeah.
and we can answer whatever questions you have. We
Absolutely.
can go over it with you personally, answer questions specific to your loved one, because everybody's different. So
Exactly.
what we say here might not apply at all. So that's fine. We do that all the time.
Yeah, and that's great. So Providence Hospice is available for any of those questions. Also, too, feel free to reach out to me, Terri Maxiner at Providence Solutions. Again, I'm here for your care coordination, navigation, and care management. I can be reached at 708-342-8090 or our website, www.providencelifesolutions.com. So thank you, Sarah. It's been great to talk about
Yeah,
palliative
thanks so
care.
much
We
for
gave
having
a lot
me.
of information, so you might want to watch this one slowly, rewind, and watch it again. I'll talk to you soon. Thank you.
Bye-bye.